One of the biggest pushes in the dental clinic has been to get our patients vaccinated. And we've had a really good response from that. And over the visits of patients coming in, I've just talked to them about the vaccination process and what that's like. We've also integrated with the pharmacy, and the pharmacist comes into the dental clinic and answers any questions that our patients might have. We also hand out at the COVID vaccine clinic toothbrushes, toothpaste, and do some oral health education to really ingrain in our patients the importance of oral health care. One of the barriers in the dental clinic has been that we do not have a lot of material linking diabetes and periodontal disease that's culturally focused. So one of our biggest goals is to get more material in that area, and also educating our patients in the link between why we would want to check blood pressure and check glucose in the dental clinic, and doing a lot of education and reaching them in those ways.
So here at Denver Indian Health and Family Services, the pharmacy department interacts with the dental department in several different ways. We provide both seasonal and routine adult immunizations for patients while they're in the dental chair waiting for procedures to begin. So for example, a dental associate may identify that a patient is due for the influenza vaccine. They can notify the pharmacy, and while the patient is waiting for their procedure, someone from the pharmacy can come over, answer questions, and actually provide the immunization while they're in the chair. The same scenario can apply to routine adult immunizations such as pneumococcal or tetanus vaccines, and this of course includes the COVID-19 vaccine as well. In addition to immunizations, we also provide education regarding blood pressure control for patients with hypertension and glucose management for patients with diabetes. Patients don't always think about the impact of their medical conditions on their dental treatment, and we're able to provide information on achieving good blood pressure and glucose control, tools such as blood pressure cuffs and glucose monitors, as well as medication refills if needed in order to help patients get chronic conditions under control. Finally, we're able to improve adherence with prescribed treatment plans by providing same-day access to both medications and prescription products. Research has shown that 30% of prescriptions written are never even picked up from the pharmacy. Our patients can leave the dental clinic with the tools they need to comply with their prescribed treatment plans.
My name is Carol Harvey. I'm Navajo. I was born to the Towering House clan and born for the Red House clan. And I love the Denver Indian Health and Family Services. They are knowledgeable, professional, experienced. You know, they care very deeply about my health and well-being, and always are so friendly and so kind to me. I can't even begin to tell you. I use the dental care services frequently to have my teeth cleaned, and also, you know, for any other dental work that may be required. And they are outstanding. I had a huge problem when I first started with the dental clinic because I had not taken good care of my teeth as a child. I had cavities in almost every single tooth. You know, I had to have several fillings done and extraction done, and they helped me to learn to take care of my teeth. You know, to brush them, to floss them, you know, to use a water pick, to really care about my dental health. And my teeth are in much better condition today, and I may have them longer than I would have had I not been here. Dr. Zuniga is a great leader for the Denver Indian Dental Clinic. I cannot say enough about her dedication to her patients, to her staff, and to keep everything running in such a friendly and environmentally safe way. And you know, COVID-19 has been very, very important to the clinic. They have tested us before we came in to make sure that, you know, we're COVID-free and not unintentionally passing it along. And that's been very, very important. Dr. Zuniga made sure that I was able to get a COVID-19 vaccination early on, and that was very, very important for my family. When I get a cold, I don't have a natural immunity to fight colds, and I usually end up sick for 3 or 4 months. The last time I was hospitalized for 8 days. So being able to get the COVID-19 vaccine in a place where I felt safe, where I trusted the care, was super important to me and my family, because they knew that at my age of 70, if I might get COVID-19, it could be disastrous. And so I appreciate the clinic. I love the clinic. They're always friendly and welcoming. I feel so much a part of this clinic, and it's super, super incredible and important for me to receive care from Native health caregivers. I've gone to other places where I did not feel the people were as friendly or as welcoming. And when I come here, I feel complete trust. I know I can trust the staff, to take care of me to their utmost best. And that is really, really important to me. And I cannot begin to tell you how grateful I am for the clinic.